Welcome to the Dropping Gems con Muchos Colores podcast. I am your host, Arely Lagunas. This is an audio community where we own and share our stories as trailblazer moms, crafting a unique and meaningful work lifestyle, leading with passion, breaking barriers, and chasing bold dreams on our own terms. Celebrating our Latina motherhood voices to bring you genuine insights of the highs, the lows, and in-betweens of working moms from a first-gen Latina lens. We don't have to travel this journey alone. Let's get started. Midwifery is a fascinating field that has evolved over centuries and plays a crucial role in maternal and infant healthcare. Midwifery is one of the oldest professions in the world, with a history dating back thousands of years. In many Asian cultures, midwives were highly respected for their knowledge and skills in assisting with childbirth. While midwifery has ancient roots, modern midwives undergo rigorous training and education. Midwives can work in various settings, including hospitals, birthing centers, and home births. They focus not only on the physical aspects of pregnancy and childbirth, but also on the emotional, cultural, and psychological well-being of the mother. Midwives play a crucial role in improving maternal and infant health globally. The World Health Organization recognizes the importance of midwives in reducing maternal and newborn mortality and advocates for their inclusion in healthcare systems worldwide. Midwifery continues to be a dynamic and evolving profession, contributing significantly to women's health and well-being around the world. Joining us today is Dr. Leslie Sanchez. Dr. Leslie Sanchez, of Puerto Rican and Mexican descent, was born and raised in Chicago, Illinois. She received her bachelor's, master's, and doctorate degree in nursing, all from the University of Illinois at Chicago. With over 17 years of experience, she has supported hundreds of patients on their health and birth journeys as a certified nurse midwife. She is certified in electronic fetal monitoring, inpatient OB nursing, maternal newborn nursing, obstetric and neonatal quality and safety, CPR, ACLS, and more. She is a licensed nurse practitioner with full practice authority in Illinois. Leslie has over 10 years experience working as a nurse practitioner for large institutions and small private practices. She enjoys traveling, attending professional conferences to stay abreast of current literature and evidence-based practices. Dr. Sanchez enjoys teaching and working with Masters and Doctoral Students at 3 well-known nursing programs in the United States. She hopes to promote diversity and inclusion in higher education amongst underrepresented and underserved students. Aside from closing the gap between minority and majority students and boosting student scholarly achievement and retention rates, she hopes to improve underrepresented faculty retention and success. Lifting the glass ceiling is a strong goal of hers because representation matters in education. The future of our children depends on it. We are thrilled to have our guest today to discuss the crucial role in maternal and infant healthcare. Leslie, welcome aboard. Thank you for joining us.
Thank you for having me.
And I'm always curious to ask our guests, what inspired you to be a certified nurse and midwife? How did that idea even come into place?
So it's actually it's funny because it wasn't something that I knew about when I was younger. Definitely didn't know about this role when I was in high school. I actually started my undergraduate program as a business and econ major at U of I Champaign. And, was really good at math when I was younger and doing great in these classes on campus, but I totally didn't feel fulfilled and found myself even back in college just kind of like, oh, this is kind of boring. I just really wasn't into it. And then at the same time, to make a little bit of extra money, I started working for a woman on campus that had a few needs, some physical assistance. So she hired me and I would just, work with her and kind of an assistant capacity with her needs and some small things of daily living. And she was great. And she actually told me, one time I was venting to her about, I'm sorry, econ classes or finance classes. And she's like, oh, well, how are you doing in them? I'm like, I'm getting A's. And she's looked at me like, well, what's the problem? And I'm like, I don't know. It just doesn't feel right. And she was the one that actually told me, she's like, you'd be a great nurse. And I was like, looked at her and she's like, yeah, she's like, that's technically what you do for me. And you're great. And I just kind of kept, thinking about it and thinking about it. And maybe like a month or two later, I walked into my advisor's office and was like, hey, I need to change everything up. Like, I'm going to apply into a nursing program. And, of course, they were like, what? You're halfway done. And I was like, yeah, just, I need to change. So I took a pause from school, applied into a nursing program, got in at UIC, and started the nursing classes. And it wasn't until my OB rotation, so when I was in obstetrics and maternal nursing, that I was exposed to midwifery care and learning a little bit more about it. And I loved, out of all the disciplines that I was in for nursing, because they have you rotate while you're in the nursing program. You do psych and pediatrics and surgery and med surge, and you do all these different floors. But I absolutely loved obstetrics. The first birth I saw, my jaw was on the floor, tears were running down my face. I was like, oh my goodness, this is it. This is what I'm supposed to be doing. And almost immediate. So I went into labor and delivery as a nurse right out of nursing school after I finished my bachelor's program. And, I was just so awed and amazed at birth. And I was doing them with doctors and with midwives because I was really lucky to be hired at a place that had both providers. And yeah, I just really found myself gravitating towards the midwifery specialty. And here I am today.
With a little bit of encouragement from your network, you went full on board, and that's something courageous to do. Not a lot of people have the courage or take that leap of faith and say, you know what, let me essentially transition, or let me start again, and let's get moving. But at the end of the day, what's important is that it's something that brings you purpose, and I'm sure that this is something that you see yourself doing for a very long time. And then a plus for us, right? For those that do need that support, we do need this type of specialty, this type of support for mothers. I definitely was aware, because I am a mom of three, is that there has been significant racial disparities in the nation's maternal death rate. And what I found very interesting about learning about your field, it's new to me. I wish I had this type of knowledge and support when I was in my childbearing years. But what I think it's really important to emphasize is that the research does show that having midwives helps improves outcomes for both the parent and the child. It's something that, it's definitely of value. I'm glad that, we're having this conversation.
Absolutely.
For us that are newer about this, can you briefly explain your role and how it differs from a traditional nurse or midwife?
Sure. So, a midwife is an advanced practice nurse, and it's actually a little bit more trickier because not all midwives are created equal. There's actually different types of midwives. So when, as a patient, as a consumer, when you are looking to work with a midwife, there are a few types. So, for example, I'm a certified nurse midwife, and that means I'm trained and licensed in midwifery. I have a bachelor's of science degree from an accredited institution. Most of us, at least from back before it was more of a transition to doctorate programs, at least have an advanced degree like a master's in midwifery, and we're certified by the American College of Nurse Midwives. So the abbreviation for certified nurse midwife is CNM. There's also just a different abbreviation. It's certified midwife, so just CM. And this is an individual trained in midwifery, and they have a bachelor's degree from an accredited institution and also certified by the American College of Nurse Midwives. Then there's CPM, which is a certified professional midwife. So they're trained in midwifery as well, and they meet the standards of the North American Registry of Midwives. So it's a different board. and they recognize different educational backgrounds. So that doesn't really mean a master's or a doctorate. Then there's a lay midwife. So this person is not certified or licensed as a midwife, but they receive training through like an informal setting or self-study or some sort of apprenticeship with a midwife. So there's just really different uh all are midwives, but we're all not the same. Some of us are licensed and certified, some of us sat for boards, and some of us had educational training. So it's just kind of different. I felt like I moved away from your question. I'm so sorry. What was
No, this is very helpful. Definitely, it is helpful because I think that a lot of us who are considering this resource and this help may have the same questions, so that definitely helps. Is there anything that you can say that you can share that are some of the common misconceptions that people may have about midwifery, and how do you address that?
Yeah. So, I kind of remembered a little bit like the difference between a nurse and a certified nurse midwife is a certified nurse midwife is an advanced practice nurse. So we're certified, we're trained, we learn how to do deliveries on our own. We're able to take care of a woman, a patient across the lifespan and perform all gynecological needs, all routine prenatal care. So we are working as a practitioner, we're working as a provider in that setting, versus a nurse is, still working with patients, but they don't get to manage the patients, do those type of things. So just a little bit different. And then you said, what are some myths, right? So, um, a midwife doesn't have much education is a common myth or misconception. So I have, as I mentioned earlier, to be a certified nurse midwife, you do need an advanced degree. Many certified nurse midwives come from a Bachelor's of Science nursing program and then went on to get an advanced degree like a master's or doctorate degree. And then separately, we continue education, right? So there's so many hours that we have to continue to not only renew our registered nurse license, but also renew our advanced practice license. Every time we renew our certified nurse certification, that requires many modules. I want to say even more than 60 hours just for modules separately for what we're doing for continuing education. So we're constantly learning and doing more things. And then separately, some midwives are additionally certified in other specialties or training. So that, of course, requires more education. Another myth is midwives only attend home births. That's not true. I work at a hospital. I work at a few hospitals in the city of Chicago. So we absolutely do deliveries in hospitals. There's not many hospitals that have midwife programs, but we do absolutely do hospital births. There are some midwives that do home births. And then also in the state of Illinois, there's 4 certified birth centers. So I actually was really lucky to work with a wonderful group of midwives, and we were doing births at the Berwyn PCC Birth Center. So that's another place where you can have your baby. It looks like a super cool apartment. You get to birth your baby in a huge tub or a full-size bed or anywhere in the room that you like, as long as it's safe for you and the baby. Another myth is we only support natural births, and that's not true. We support all types of births. I've had patients that wanted pain management or needed assistance with having their labors induced or augmented. And even if you're having a C-section, to the groups that I work with, we often sit in the back with the patients. I mean, one hospital that I work at, the midwives are actually trained as surgical first assists. So they're participating in your C-section with the surgeon, the main hospitalist. And separately at another hospital, although the midwives aren't trained there to first assist, we still support and sit with the patient and their family member in the back. So we do support all types of births. And another myth is we only see people for pregnancy and birth, and that's not true. As I mentioned earlier, we see patients across the lifespan. And then you can't be under the care of a midwife if you're high risk. Um, that's not always true. Sometimes we can co-manage patients with a provider, with an obstetrician. And then, other silly things that I've heard. And it's funny because I ran into someone at a conference, and when they asked me what I did for a living and I was explaining it, they kind of looked at me up and down and they said, "Oh, that's funny. You don't look like what I would think a midwife looks like." And, of course I laughed and I'm like, "Well, what do you mean?" And they're like, "I don't know. I just picture like, someone knitting in a corner, like waiting for a baby to be born." And I absolutely laughed so hard. I'm like, "No, we all don't wear Birkenstocks and knit in corners and wait around for babies to be born." I'm like, I actually don't know many people that do that. And I'm
Right.
not saying that there isn't. I'm sure there is, but we're all so different. I mean, I'll wear my Jordans and listen to old Kanye, while I'm waiting for a baby to be born in between some birthing support, if mom is resting. So we all look so different and do such different things. But those are just a few of the myths.
Yeah, I think you nailed a lot of misconceptions. And even for me, learning about this is very helpful. And, I appreciate your knowledge and the wisdom that you're sharing with us. You talked about earlier how this work is fulfilling for you. In your role, what are the things you have used in your work environment? What are the skills that are enhanced because of the work that you are doing?
So, I mean, we're constantly educating patients and their family members. So, aside from, you know, going over, birthing and just kind of coping and comfort measures, communication, right, is a humongous skill that we do not only with families, but we do it with our fellow providers and the team that we're on. Because in order to provide safe and optimal care, communication is a huge skill that we kind of constantly practice. And then separately, of course, there's deliveries and the physical skill that's required there. Midwives do vaginal repairs, which is often needed sometimes after births. And yeah, assistance with breastfeeding is huge. Just kind of recognizing, perinatal mood disorders during pregnancy or after pregnancy, teaching families how to navigate those things when, we worry about a patient kind of exhibiting signs and symptoms of just a perinatal mood disorder. Like it could be as simple as the postpartum blues or something a little bit more serious like postpartum depression, which is much more common. And I'm so happy it's talked about more often now. And even, in very rare cases, postpartum psychosis. But those are just a few of the things, constant communication and education and time management is ginormous. I'm able to take that into the practice setting that I work in and, apply it at home as well. You have to absolutely be so great because midwives do take a lot of their work home. Like we try not to, but, if you see patients in clinic, all those follow-up calls and messages and lab results you have to do, and then do patient follow-up and just make sure that people are taking care of their own best health. And just being a patient advocate is huge.
That's really great. And what I hear, you're providing that emotional support, which is really, really great and needed, especially for mothers and, first time moms and moms who've been moms for second or third time. That emotional support is always welcome. That's helpful how you're able to use all these skills such as communication, time management, follow up, in a way that you can use it in your field. As I'm hearing you talk about the skills that you use, I'm also hearing about the benefits of choosing a midwife for prenatal care and childbirth. Anything else you want to add to that?
I mean, yeah, some benefits are very common and well known now. Decreased risk of needing a C-section, reduced rates of labor induction, reduced rates of pain medication if needed, like regional anesthesia, decreased infant mortality rates, decreased risk of preterm birth, decreased risk of third and fourth perineal tears. As I mentioned earlier, first and second degrees are very common. But having midwifery care evidence does show a decreased risk of third and fourth degree, which are more serious tears, lower cost to not only to clients, but also to insurers. an increased chance of successfully breastfeeding, or at least starting to breastfeed, and increased satisfaction in quality of care. And then most importantly, preventing death, right? Maternal and neonatal death. So just
Mhm.
a few of the benefits that, midwives are attributed to.
I was doing my research too, and also decreases C-sections, right? I was very fortunate that all my births were vaginal, but I know many people that have had C-sections, and I recently learned that having, the support of a midwife is very helpful in reducing those C-sections.
Yes, absolutely.
Would you be able to share any challenges or unique situations that you have encountered in this journey, and how are you handling that?
Yeah. So, some challenges are hospital politics, a lot of the time, poor staffing. And that doesn't just include nursing staffing, because we do need nurses in order to take care of our patients safely. But midwifery staffing, just not groups or hospitals programs just not being able to staff the midwives. And there's so many different reasons for that. We actually just touched about it in an article, in a WEBZ article in Chicago by Kristen Schwartz. She was able to highlight a little bit of what these challenges are. And she actually asked me, and I was so surprised and shocked that someone would reach out to me about that challenge. And it's as simple as just finance. And that's because just, we go to school, we get our I got my bachelor's, I got my master's, I got my doctorate degree. I'm certified in so many extra things in specifics to obstetrics and midwifery care. But it's ironic that I actually get paid more to staff as a nurse than I do an advanced practice nurse. So, as an advanced practice nurse, I'm doing more, ordering more, I'm more responsible for the patients. It's more litigious, and it's ironic that I get paid so much less in that role, when that role requires, more malpractice insurance and just more of a time commitment. The midwife schedule, and it really depends on what practice or what group you work for, but a lot of my friends, a lot of my colleagues, they work definitely more than 40 hours, sometimes 40, sometimes as much as 60 to 70 hours, depending on their call shifts or depending on charting. Because as I mentioned earlier, we take work home sometimes. So, well, if we staff 2 clinic days and we have patients all 8 hours, we still have to call patients all the labs that we did that day, all the follow-up, notify people of any STD testing that we did or any medication, education on blood work, not just related to gynecology, but a well women exam, an annual exam, where we're checking your liver, your thyroid, your cholesterol. So all this requires an extra phone call, an extra message, and of course, as a patient, imagine how many questions you have when your provider calls you and says, hey, you tested positive or for this, or your good cholesterol's that, but your bad cholesterol's this. It's always going to require more conversation. So this is usually all off the schedule and all off the clock. A lot of groups don't reimburse the midwives for the time that they spent while they're not staffing the hospital or while they're not doing a clinic schedule. So I know personally for me, it's a lot of a financial situation. Just kind of taking it's as much as a 20% pay cut when I work as a midwife than I do as a nurse, which is a little sad, right? Because I went to school and I kept furthering my degree, and I got to a really great place. And my colleagues will say midwifery is a calling. Like, you love it. No one's doing it for the money, but we also have to sustain, right, and feed ourselves and our family and pay bills. But it's just sometimes really hard for work-life balance and being able to sustain when we're making so much less and working so much more. And then I don't know if I said this earlier, but I'm a mom, so just hiring someone, right, to watch my children while I go and staff the hospital. And then especially if I special someone, that means that I'm going to be there for their labor and birth. And I'm not sure how long your babies took, but my first baby sure took a while. So you can be gone a whole 24 hours or more. So those were just some of the challenges that I faced. Some financial challenges, and a lot of my colleagues will say, autonomy, or and also I've experienced it as well, where and it really depends on what the hospital setup is like and who's the head of the department, the obstetrics department. Are they supportive of midwifery care? There's so many other variables that go into challenges, but I'll say a lot of it is staffing, hospital politics, reimbursement. Personally for me, I would love to staff more as a midwife. I'm definitely much happier and fulfilled when I work in that role. I just, as a single mom, it's really hard for me to take such a large pay cut. So I still have my foot in a nursing realm. But yeah, that's just a few of the challenges that we experience. I think hospitals need to do a better job investing in midwifery care. It has all these great benefits, but you know, we just need to see a little bit of change, not just for our profession, but for our patients. This is, maternal child outcomes. So hopefully we see some change in the future and some politics at work.
There needs to be more support for this type of field, but also for working mothers, right? You mentioned some of the challenges. This is really crucial for promoting gender equality, family well-being, and at the end of the day, having the support will just create a more thriving economy, right? And I think as mothers, we often face unique challenges and responsibilities, and providing the right support can help balance the work and family roles effectively. Everyone has a different situation. And in your case, I can just imagine the extra elements, being in a single household. A lot of this has to do with providing more equal pay. So we do need that financial support from, in this case, the hospitals, right? But also employers in general. And then I think that, providing the support, it's not only the right thing to do, but it's more of like, it's a matter of like social justice and a good business practice. Companies that prioritize these support really have more satisfied and loyal employees, lower turnover rates. And at the end of the day, like the ultimate goal is to help, right? To help these patients, to help these mothers who are in the process of childbirth.
Yes, perfectly said.
You are a mother. So tell me a little bit about your motherhood journey, and what do you enjoy the most doing with your child?
So my kids are actually a little bit bigger now, but so I have an 11 and 13-year-old, and both are girls. And they've been so great about because they were pretty much born into it. I was pregnant with my oldest when I was in the midwife program myself, at UIC. And so and even when she was a few days old, she was with me in class, and I was nursing her in the back of the room. So they both pretty much been around me, and of course they're into what I do. And it's funny because they know way more about the female reproductive system, and their amazing supports at breastfeeding. They've gone to me with friends' houses to help with breastfeeding, and all my friends that breastfed, and just other things too. They're just so well educated on it, and I love that we'll watch a show. For example, there's a show on channel 11. I think it used to be on, I think now it's on Netflix, but it's a show, like the setting is like 1940s, I think, like London or England, and it's To Call the Midwife. So it's a show about midwifery care back then. And it's a really good show, and a lot of the medical facts are like spot on. But my daughter was watching it with me, and I think at the time she was 9 years old, and they had said something on the show, and my daughter had said something like, that's not possible because the placenta feeds the baby, and this wouldn't happen this way. The baby wouldn't survive. And I looked over at her like, oh, absolutely, you're right. Like the baby needs the placenta. So I just kind of like laughed, but they're great. And when they were little, especially, they used to, if they saw a mom breastfeeding, they would be like, look, mom, she's breastfeeding. And then, good job, mom. And, just kind of little, to a stranger, whoever it was, like they were always just so supportive and great about that in general. So I'm just so lucky. They're amazing.
And they have you as the expert. So I love that, how they're very in tune, and I think obviously, they're both girls, so they appreciate that as well. How do we accomplish that work-life balance? But what has worked for you?
Still a struggle. Like I
Yes.
still find myself working on that, if that makes sense. I
Yes.
mean, since they were small, and I tried to get all the school and just do everything back to back because I'm like, oh, I don't want to do it when they're in these school ages, where they're smaller and have activities. I would do my best to just uh you know, well, the one thing I did was definitely make sure I had a schedule at work while they were at school. So I try not to take weekend call. I try not to take night call, just so I can have more family time with them or more evening time with them. Constant communication. I have a great support system. My mom is my queen. She is great at helping me with logistics and helping me watch the girls. But I also have other family members and friends that are just supportive and just constant communication, co-parenting as effectively as possible. And yeah, just I'm still learning, to be honest, because I find myself, trying to squeeze in schedules or do things, but they're great and they're understanding. And I try to plan as much activities or vacations and, really when I have a day off or vacation time, really take advantage and book something and take them somewhere or, make the best out of a staycation just to maximize my time with them because they're getting so big. I
Yes.
sometimes, my 13-year-old's almost taller than me and that flew by, so just kind of doing my best, but I'm honestly still working on it myself.
And I think that's something that we all fall into that category. Like we're all working on it. I think we're doing our best that we can, and with the constant reminder that we got to fill our cup, right? What are the top considerations to keep in mind for someone who is considering going into this field?
Well, definitely just it's definitely a commitment, so they should absolutely consider that aside from the academic work, if they're going into nursing school to follow this route, or even if they're already nurses but want to become midwives, is that aside from the academic work, it's still tons of clinical time and clinical hours that you have to complete. So you do have a certain amount of clinical time every semester while you're in the program. We do attend conferences and continuing education. So just knowing that it's a big commitment. So you definitely have to communicate with your family. So if you're doing that on top of being a parent, definitely need to communicate with your circle, family and friends, and just what your needs are going to be while you're in the program and how you're going to show up for your loved ones, what that looks like. It was a little hard for me when I started doing the program just because, as I mentioned, I was pregnant. I was pregnant in the middle of my program, so I had my newborn when I was in the middle of it. But huge commitment and just kind of constant communication and just asking for help when you absolutely need it. So I know people say like, oh, nursing school is hard. Yes, absolutely. So midwifery school is harder. It's like nursing school on steroids. So definitely need to just make sure you communicate and prioritize, and time management must be impeccable.
And you mentioned something key, right? Asking for help. Are there any memorable moments or stories from your career that stand out to you? If you can share the impact of your work, and obviously there's something that keeps you going, right?
Yeah. So it's, I've seen hundreds and hundreds of babies born, right? Hundreds of births, and they're all so unique and different. And I've, just whether the patient or their family members verbally said, they're just so grateful and so sweet, and this is just such a important moment and milestone. Um, to me, it's just so sweet, especially like when like I'm awed by every birth. It's really amazing, but I think it's absolutely full circle, and especially when patients come back, and they show you their babies or bring you baby pictures, and we absolutely love that. And especially when they come and visit you and they're so much bigger. I mean, I've been in labor and delivery for 17 years now, so there's and I became friends with some of my patients, so to see their kids on social media and they're seniors in high school. And I'm like, oh my goodness, this is crazy. Those are just kind of more fulfilling, just kind of seeing, full circle type things, seeing them in their family setting or, um, it's just great. And I just feel so lucky. I'm so happy I didn't stay in like my business econ finance role. I think that I would have just not been so happy if I would have stayed there.
Is there anything you want to share with us about what does your short-term goal look for you? Any exciting things coming up for you that you want to share?
I have a few things that I'm kind of working on, but one thing that I want to make a long-term goal is kind of figure out, and I don't know what it looks like yet. I just know I want to do it, is I need to find a way to get more minorities, more Latinos, more Black midwives. I want to get more Latinos into nursing and midwifery and or advanced practice nursing. I just need more. I want to see more representation is just so important. And I've had students because I also teach for a few nursing programs as adjunct, and I've had students reach out to me and ask for personal mentorship. And they just kind of were so honest and said, I didn't even know we had a Latina professor here, or you're the only one, and I've been here for 6 years or four, whatever it is. And that made me sad. Like, I was like, oh, but no, it shouldn't absolutely be this way. Representation is important. So I really would love to find develop a program or find some sort of way to, advocate and get more people, get more minorities in this field.
That is such a great goal and mission. There's still a lot of lack of representation in a lot of fields, right? And what an opportunity for these students to be able to reach out to someone that looks like them, someone that they can relate to. That's really important, especially for the community. Just having the mission, I know that just hearing you out, I can tell that you're passionate about that, and I'm sure that you'll be able to find more clarity and actually, have a bigger impact that you already do, within the community.
Right. Working on it. I hope to work on it soon.
Thank you so much for joining today, learning about what you do, what your mission before, right? And your mission, continuing. So that's always great to hear. We're so excited to have you. Thank you so much for the knowledge that you provided today.
Thank you for having me. I really appreciate the voice.
Thanks for listening to the Dropping Gems con Muchos Colores podcast. We have a new episode every month. If you enjoyed today's episode, please take a moment to leave a review and subscribe so you don't miss a beat. Thanks for listening, and we'll catch you next time.